Jawline and mandibular angle. The mandibular line, the rear mandibular angle, marionette lines and the front chin make up the aesthetic anatomical unit of the lower third of the face. This unit develops synchronously, with maximum aging starting at 50 years. The lower maxillary is the bony structure that forms the base of this region. Aging of the lower third of the face is the result of several factors. Contractions of skin muscles. In front, the depressor anguli oris muscle with regard to marionette lines, and the platysma muscle, which is woven with the posterior fibers of the depressor anguli oris. At the back, the masseter muscle, which is minimally affected. Changes in the adjoining fatty layers, in particular the increased volume and sagging of the superficial adipose compartment of the jowl, for which ptosis breaks the mandibular line and aggravates the marionette lines. Lastly, the presence and fixed nature of the mandibular ligament, which produces the mandibular notch and increases the breaking of the line of the oval by dropping the jowls back. These anatomical phenomena are accentuated by other elements: retrogenesis and reduction at the lower face area. The main anatomical precautions of the oval injection concern, in front, the facial pedicle, which enters the region via the submental notch by pre-crossing the mandibular edge, as well as the facial, motor and chin sensory nerve. Pathognomonic of the sagging of the facial tissues and muscular hyperactivity, the breaking of the mandibular line can affect the entire oval or only the anterior part when the mandibular angle remains well defined. The loss of the oval is a frequent indication due to its anatomical reality. When it is complete, the first step in treatment of the back of the jowl is to accurately outline it. The cannula or needle is inserted at the mandibular angle or slightly forward of it if there is a lot of cutaneous laxity. Correcting the posterior segment of the oval is done along the length of the posterior notch, from the mandibular angle to the lower part of the jowl without exceeding its limits in order not to weigh it down. The notch is essentially filled opposite to the inferior face of the mandibular bone, using a tight fanning technique that succinctly rises up the lateral face of the bone to restore the mandibular angle. The second step in treatment may be indicated alone if the oval loss only involves its anterior segment. The filling of the mandibular notch labial commissure triangle by Radiesse allows recovery of the mandibular linearity and the removal of the notch and marionette lines. Clinically, the mandibular notch is bordered by the anterior end, the para-chin, and a posterior end, the jowl. The cannula or needle is inserted at the anterior end of the mandibular notch. The injections are made along the length of the notch opposite the inferior face of the mandibular bone using a tight fanning technique. Then the adjacent lines rise up to connect with the marionette lines by subtending the fold below. After disinfecting, make a pre-hole with a needle across from the mandibular angle point to the dermic-hypodermic junction and insert the cannula parallel to the cutaneous plane in the desired injection plane. Make the retrotracing injection in the inferior face of the mandibular bone by removing the syringe to obtain a linear and homogeneous Radiesse deposit. Again, opposite the inferior face of the mandibular bone and without removing the end of the cannula from the skin, change its direction and inject as many new lines as needed. Going up along the lateral face of the mandibular angle, the adjacent product lines are fanned out while limiting the number of injection points. Massage and shape the areas injected to evenly spread the product. With Radiesse, the product deposit and correlated correction are assessed immediately. The results obtained using the Radiesse injection are as follows when correcting the jawline and the mandibular angle.